John here with another meeting of the Retiring Club. In this meeting of the Retiring Club, we're going to be talking about the healthcare option as a new retiree. And I have retired as September 26th from Morgan Stanley, and I worked on the E-Trade Help Desk. And I am now going into the second month of my early retirement. In my previous video, I started talking about how I was going to finance my early retirement with taking the funds from one of the individual retirement accounts and transferring into my cash box. Well, that has been completed, as well as half of the funds from the 401k over at Morgan Stanley have been transferred to the designated areas that I want them to go to. So I'm real happy about that. And I'm in the process of test driving the automatic withdrawal or drafts for the mortgage, as well as the home owners association um, draft on my high yield savings account, which I call the cash box, so that if I'm incapacitated, if I'm unable to be at home, if I'm out of the country, uh, get stuck over in the country with tsunamis or something like that, and my mortgage will automatically get paid. And that's how I'm structuring. I won't even see the mortgage. I'll know it's getting paid, but I'm allocating. So that's been taken care of. Now, one of the things that is the second on the top of the list in my retirement plan is the healthcare. So I knew that I was going to be coming out of the firm. And during that time, I went and got my uh, the flu shot. I had some inflammation in my foot, so I spent all of August getting that taken care of, visiting that doctor, as well as I got 2 crowns completed on my teeth with the dental, which is with MetLife, as well as I went to see a dermatologist. They did see a couple abnormal spots, and those are taken away, were cut out and sent off, and that has been taken care of. There was only one that they thought had some cancerous cells, but it wasn't malignant. So I'm good on that part. And so now I did get offered the Cobra from my employer, as well as I went ahead and applied for the ACA. So my income is very, very low. Um, so I qualified, and I actually have ACA for 2 months. Now, the big holdup right now is what they're going to do with it. I think that's why we have a shutdown. There's a big standoff on it. There's no real plans for healthcare that I know, except just get rid of Obamacare. Just it's a Democrat program. Let's get rid of it. So um, I'm applying for it, but we'll have to see what happens. So I'm going to go ahead and get into my presentation. We'll look over some of the numbers. My name is John, and you're with me at the Retiring Club, talking about the second part of my retirement plan, healthcare. All right, folks. So one of the biggest things for me, other than making sure I have enough money, which we covered that, I'll link that video to this one, and just in case you're catching on and say, hey, I like how this guy's presenting himself. That way you can catch up to with me on this. Healthcare, including dental and vision. We're going to help focus on the healthcare and the dental. The vision, I'm not too concerned with that right now. I recently had a refraction done, and the ophthalmologist seen me earlier in 2025. I actually got a pair of glasses. They seem to can't even get grinded correctly on the glass. So I don't really want to too much care about that. But as someone who resigns from a firm, they offered this Aetna at $964. We'll just round it off. Anything over 50 cents, you just round it off. I had a $600 individual deductible. I think I had met that. And then after that, they pay 80% up until you hit that $2,000 out of pocket, and then everything is covered at 100%. So now I have hit the out of pocket max on 3 different occasions over the last 5 years. And when you hit that, anything that you think you might want to get checked out, that's when you go ahead and submit and get it done. I've had an angioplasty done, and I think there's a little blockage over here, so we know about that. I've had a nuclear stress test that was expensive, and I had these arteries done with an echocardiogram, making sure that is good. Um, I've also, like I mentioned, went to see the dermatologist, and I've gotten hearing aids. I went to have a hearing aid test done. There were some frequencies that I couldn't hear at all, and I got hearing aids for $3,000. I did not have to pay. So all of this was structured and planned for me as a retiree, knowing that I can be let go or I'm going to be retiring and some of this stuff isn't covered. So there we go. This is what they were offering. If I had some cardiac issues, I would just have to withdraw more money out and probably go with this insurance right here. Um, just to keep the insurance going, because a lot of times with the cardiac issues, the doctors, they want you in all the time. Let's come in 2 months. Let's come in 3 months, 6 months, and blah blah blah. And you need to have insurance because their visits are a few $100. Okay, so I went on ACA and I was looking to keep my current doctor, and what I found was Oscar Healthcare of Georgia. It is a 4,700 deductible. So when I go to see this doctor, when they start sending those charges, whatever the bill is, the negotiated price, that's what I'm going to be winding up paying. And here they're talking about what they pay. We'll have to see how this goes. Preventive care, what you pay before meeting deductible 000. You got a primary care visit of $70, a specialist, urgent care, 125, in the emergency room, 100%. And then what you pay after you meet your deductible is the same. This is just to cover you in case you have a critical illness. Most people who have some money put away, like I have that $5,000 safe harbor, you could just go to urgent care, but as long as the tests aren't too sophisticated, you'll be okay. Now, this is only for 2 months. I'm trying to reply for it for next year, but we don't know if this is going to be around. So we'll deal with that later. I do have some insurance. I had a 1 month gap. Now, the dental, I went with MetLife Take Along, and this is what we got right here. It's 43.42 a month, and for the year, it's 521.04. So let me see if I can stop and bring back, and we'll look that over. This is way better than the AARP uh, dental plan and anything else I can find, because when I talked to them, I asked them, I said, hey, I'm planning on retiring. And if I come in for these checkups and clean, what my cost is going to be. And they said it would be 160 per visit. So that's 320 per year. Now, as a retiree, if you're eating hard candy, you're eating cashews, and there's a rock in there or something super hard, you bite, it will fracture that tooth. You can get the bonding, which may fracture again, but the easiest thing is to get a crown. My doctor's crowns are running over 1,500, and that's why I got the two done for $719. This would probably cost me, if I had to get a crown, cost me about 500. It would be half, is what they're saying. I'm going to come back. We're going to look this over real quick. This is called MetLife Take Along, and I'm going for the single. Okay, so stick with me. All right, so let's take a look at the MetLife Take Along for seniors. I'm going with a PPO medium. They have an HMO, but my doctor was not in it. Now you can see the price is real good here. You should be able to see that. Let's bring it up a little bit. So because there is a 6 month waiting period and I got the money, I just went ahead and enrolled. So my coverage starts December 1. And if I needed to have something done on my teeth after Labor Day, I will be able to get it done. But let's look at what they have to offer here, okay? Let's see. I'm going to have to bring this up. I know my face shows down at the bottom. Preventive and diagnostics for that $521, oral exams, the x-rays, the cleaning, the fluoride. And then the doctor comes in, he does his checks, and he'll give you the clear light on that. Now, basic res- restorative services is 6-month waiting period. Let's see what that brings in. Full mouth x-rays, sealants, space maintainers, and all this. This composite filling, I think that might be the bonding. Periodontical, that's the braces and stuff. And it doesn't say too much about the crowns. Well, let's just see what it has on the crowns in here. Oh, 12-month period. Crowns. So I'd have to wait a whole year before I got a crown. So I was mistaken on that. But they cover 50%. Well, that's why I got them done. This service here, I will probably keep going with that. Root canals will be half. Some surgery will be half. Implants start taking half. Now, this is covered up to $1,500 here. So that's about it. This is MetLife Take Along for seniors. This is what I like about it. And those crowns, one we place in 10 years. Major restorative says 12 months. I thought surely it was 6, but I'm okay with it. This is what I want. It'll be all right. All right, so that's it on that. Now, that emergency room visit, it says you pay 100%. Well, I got something for that. And I'm going to bring that up. We'll come back because I have, for the last 13, 14 years since 2010, I've been carrying accident and critical illness insurance from UMA. I've been paying them religiously $59 a month for all those years. And we're going to talk about that. So I'm going to get ready to bring that up. Okay. I'll be right back. All right. Thanks for sticking with me. So I have to correct my statement. The periodontics, that is treatment of the gum diseases. That's all that deep cleaning, the scaling, and all of that. The orthodontics, that is the braces. So I want to correct that. So if I needed to have that done, it would be done. Now I'm gonna be frank with you. When you go from one dentist to another, they always want to do that deep cleaning as a baseline. I've had two new dentists do want to do that. And when I went back to my doctor, he told me I didn't even need it. He did it the first time I came in, and then after that, I did the maintenance. I've got that water pick. I did the dental floss. I've got me a battery operated toothbrush, and I changed the heads. And even the ladies was saying that ever since he started doing that, his teeth have been much better. All that scraping and digging around in there, they don't have to do that anymore because you know it can be kind of painful. All right, but here is the UMA critical illness. This is what I got. I've been carrying this. Comprehensive coverage for life, serious health challenges. Now, I've been covering this and I've carried this ever since I've been working. I got this at the recycling center when I was in Savannah. And because of the elements in my family, and it was cheap, I went ahead and went with it. After I left the firm, it went up a little bit more, but I kept it. So it covers heart attack, stroke, major organ failure, this end stage renal failure, whatever that is, coronary artery disease, that could help with that blockage. The it's like 40% is what they said. And then you got the cancer here. Prostate cancer runs in my family, heart disease. We've had people who've had strokes. My dad had a heart attack. So I'm carrying this, and what they have is a form. I would need to keep that close by, have the doctor fill it out. Then I'm supposed to pay all this stuff, and they reimburse me a set amount. So even with that high deductible plan with Oscar Healthcare, I'm keeping this for a whole nother year. It's already baked into my budget, and once I go on Medicare, I'm dropping it because it's about $60 a month. And I'll use that to go towards the vision and the dental. But that's it on my presentation. This is how I'm managing it. UMA for members. And let's see what the accident says. Broken bones, burns, tendons, or ligament tears. This could, I got this because I was doing that private security in case I got shot. But anyway, I'll keep it. You never know. You might need it. Okay, so this is John, and this is my meeting with the Retiring Club on healthcare as an early retiree. And this is something I hope my tips help you. Remember, you hit that deductible, talk with your doctor, and get everything done so you don't get stuck with these once you retire. Thanks for watching.